tell me a little bit about what you do and what neural manipulation is.
So I think what's important to start with is that the human body is a bunch of different pressure systems. And what that means is that we have in our brain, we have a pressure system. In our thorax, in our chest, that's another pressure system, our lungs and the air that we breathe, and our abdominal cavity. And what happens is that pressure system, it's moving a bunch of fluid, whether it's blood or whether it's cerebral spinal fluid. And in neuromanipulation, what I'm focusing on is the cerebral spinal fluid. That fluid is what bathes your brain. People have heard of a spinal tap, and that's what they're taking when it's through the spinal cord. But that cerebral spinal fluid, it bathes your brain, it detoxifies the brain, and it moves nutrients through the brain. It also moves down through your extremities, through your spinal cord, and through your arms and legs. And so what happens during this cranial rhythm is what we call it. I refer to it as a wave because it takes 10 seconds to fill your brain and then 10 seconds to then move through your extremities. And so that cranial rhythm is one pressure system. And we listen to it in various different parts of the body. I might listen to it at the head, I might listen through the chest, the abdominal cavity, and then through your limbs. And the body likes to hug lesions. So if there's a fixation, if there's adhesions, if your fascia is restricted and it's compressing or straining on a nerve, then what happens is you can start to develop pain patterns, numbness and tingling, certain dysfunction in organ production and function. And so what I do when I listen to the body is that I listen to that rhythm and I go to where that fixation is, it pulls me to that lesion, and then I excite the tissue, and then I release the tissue. And when that happens, there is an increase in circulation, there is an increase in nerve conductivity, and that improves the function of the body, that reduces pain and eliminates dysfunction, if you will. But it all starts out with understanding the pressure systems throughout the body.
Now, tell me a little bit more about that pulse or the flow that you were speaking of. How could someone that doesn't know anything about neural manipulation, what could they relate that to?
So, you know when you go to a cardiologist or your doctor and they take your pulse, they're listening to the pulse of the blood in your arteries, correct? Well, I'm listening to basically the blood of your nerves. That's the cerebral spinal fluid. And so it takes 10 seconds to move throughout your body, so it's a lot slower and more delicate and sensitive than listening to the pulse that you can pick up at your wrist. So that's really where I'm honing in, but it's a much more subtle type listening technique, and it takes many years of practice to really hone in on where the body is pulling me.
And when you're listening, how do you know the body's pulling you somewhere?
How do I know the body's pulling me there? Well, because what happens is that everybody's body will hug lesions, and those lesions can come from when they were born, to accidents they had as a child, to athletic injuries, tackling people too many times in football, a ski accident, falling off a bike. It can also happen from surgeries and surgical procedures that create scar tissue that can form around fascia and nerves. It can also happen where organs can get restricted, and organs have an innervation in their body just like everything else does. And so there is nowhere in your body that doesn't have a nerve and doesn't have a nerve impulse. And a nerve from the ends of your skin is the size of a hair, then attaches to another nerve that's a little bit bigger. And that nerve attaches to a little bit bigger nerve that then attaches to your spinal cord that then attaches to your brain. And so everything is interconnected. And so releasing one part of the body can have massive and profound impacts in other parts of the body. I've treated patients that would come to me and for bladder pain, and I'm being pulled to their ear. And I'll say to them, what's going on in your ear? Oh, I've been going to an EMT and doctors to try to figure it out. I feel like I have fluid in my ear. And then I get pulled to the ear. I release that facial nerve and the vagus nerve that exits out of the ear, and all of a sudden their bladder pain is better. And it's because of the way that the human body is connected. Everything is connected together.
Could you tell me more about long-term injuries? Have you ever found when you're listening in a patient something that they didn't come to you for and didn't mention, and you have you ever found something from years previous?
Like older injuries
Yes.
that are connected to the current problems that they have?
Or maybe not even connected to the current problems, but you found things that they were unaware of from past injuries.
Yes, usually what happens is our nerves hold our memories and they hold our past traumas. And so often I'll get pulled to a certain area of the body, and when I release that area, it'll pull me to somewhere else, and I'll say, did you ever have a bronchitis or have asthma as a child? And they'll say yes. Or I might get pulled to their shoulder and say, did you ever have a shoulder injury? Oh yes, it was a dislocation. And that, so yes, I can get pulled to older injuries that then, as the body unravels itself, as you will, it can tell a story. And that story often follows the story of the individual's life and the different things that have happened to them. One of the things that's important that I have not mentioned yet is I did mention that you can have fixations and restrictions in nerves and in your viscera by not only external forces like surgeries or accidents or more motor vehicle accidents, but you can also have it internally. Infections, COVID, inflammations in the body. That inflammation creates swelling around tissue, and then that tissue gets stuck and that fascia gets stuck, and that can create fixations through the body. So people that have had asthma, people that have had endometriosis, people that have had autoimmune diseases and have a chronic state of heightened inflammation throughout their body can have restricted nerve and different types of nerve tissue and organs that are very much affecting whatever symptoms or whatever dysfunctions that they are going through at the time.
What do your clients feel when you're treating them? That's the first part of the question. And the second part is, when they leave and you see them again, what do they typically report back to you of not only what they felt during treatment, but what transpired over the following weeks with the healing?
So you might have to remind me the first question again. What do they feel? What are they experiencing?
When your clients are on the table, what are they experiencing? And what have they told you they feel or experience in the week post-treatment?
So what they're feeling while I'm treating them, often when the nerve gets released, you can often have a heat. What's happening is that a restriction in your body is stored energy, and when that energy gets released, very often it gets released as heat, but it can also get released in other ways. People can have an emotional release. Some people can start to cry. Some people can start to tell a story and they don't understand why, because a memory all of a sudden came to them. And the nerves store that memory, that stores that trauma. So very often people can experience the heat that is released, tingles running down limbs. They can feel things in other parts of their body and the connection. Oh, wow, I can feel that in my ear, and I can feel the pain in the bladder releasing. That is what they're feeling while I'm at the table. It's not painful. It's more like they feel like there's energy coming to that area. There's release and opening and breath and oxygen. They can breathe deeper when I'm working in the thorax. They can move and expand their body. And that then also gets taken over after the treatment, over the weeks following the treatment. It's important for me to emphasize that I'm not healing the patient. The patient's body is healing itself. I am only helping open the doorway for the body to then take over and heal. It's the miracle. It's the miracle, and it's the technique that is just helping that miracle happen. And so what happens when people, after the treatment takes place, is over the next week or two, they can experience improvements in sleep, reduction in their pain, the feeling like their memories come back to them. They can have experiences of improved strength and stamina, vitality. It's a homeostasis. It affects the entire body. Remember, everything is connected to the nerves. Nerves are the first thing that is created in utero. And so you can't have a heartbeat until you have a nerve impulse. And so everything in the body responds and needs to go back to that. Your brain is grand central station, and the nerves have to communicate back and forth. The chief communicating officer is the vagus nerve. And we are so excited about learning about the vagus nerve, and there's so many wonderful things that are going on out there right now for treatment of it. because it is the main officer that is communicating to the brain and the rest of the organs and the rest of the body of what's going on in your environment. If you're getting chased by a bear, the vagus nerve is what's telling the heart to beat faster, the lungs to breathe deeper, the muscles to start to contract faster, and the brain to start releasing certain hormones and neurotransmitters to make all the different organs and everything start to respond. The adrenal glands have to release hormones. It's a huge response, and it's the vagus nerve that makes sure that everybody is at the party and everybody got the memo. When the vagus nerve gets disrupted, it can completely be a cutoff to the communication to the grand central station of the brain. And so when working with these patients and what they can experience, a lot of times definitely impacts the vagus nerve. And so they can leave feeling more relaxed. They can leave feeling like their anxiety has dropped and they're able to process things better. So it has, and everybody is different. But the bottom line is it's very subtle but extremely profound.
I got so lost in listening to you.
Was that good? It wasn't boring?
So good.
Okay, all right.
I'm like learning as I'm listening.
Yeah. No, it's okay if you don't have a question. I just thought, I don't want to, if you want to stop it and then do you feel like we got enough?
You have so much, like that was great. I do want a little bit more talk about the patient's point of view. So all the education you just gave on the inner body is fabulous, and how
the patient's point of view. So
like, I'm coming in, I'm laying on the table, it's a light touch, we talked about it. I may be experiencing the things that you discussed on the table. When I leave, I may feel a certain way. Later on, I may feel a certain way. But let's touch on some of the things, not deep into them, but like, if someone presents with this and you treat them, often they feel this. If someone presents with this and you treat them, like some of the different things that are commonly treated in your practice.
So one of the things that I commonly treat is migraines and neck pain.
Say that again, because I spoke over you.
Okay. So one of the things that I commonly treat are migraines, headaches. But often migraines and headaches are associated with neck pain. And so often people can come in and they're coming in because they experience migraines on a regular basis. They have tried multiple different, sometimes surgical approaches, but medicine and different treatments and physical therapy, and they have not been able to get any relief. And one of the things that happens when I get pulled into the cranium and into the brain is that I am working with different cranial nerves and different parts of the brain and the pressure system of the brain to help reduce that pressure and improve the function. And in doing that, it also affects the neck, because the neck is very much the transitioning bridge, if you will, from the rest of the body to the brain, and vice versa, the brain down to the rest of the body. It's the bridge. And so often people can have headaches because of restrictions that are happening in the neck. People can have neck pain and not even realize that it's associated to their headaches. That's one thing. Another thing that can happen is people can come in and have a lot of thoracic shoulder pain, and it's coming from their chest. Your thoracic cavity is a huge, there's a lot of different tissues and organs that are running through this part of your body. You have your heart, you have your lungs, you have some of your biggest arteries and veins, and a ton of nerves and plexes. And what can happen is, if you have restrictions, if you are asthmatic, if you have had multiple infections and bronchitis, if you've had any fractures in your collarbone or in your humerus in your shoulder, it can impact, and people can have shoulder pain and not realize it's coming actually from restrictions in their chest. People that have had open heart surgeries or portals because they've had to do immunotherapy, that can create scar tissue around really important nerves like your vagus nerve. So people can come to me for shoulder pain, and then they're realizing as I'm working, I'm releasing their chest, and all of a sudden their ability to breathe has improved. They're realizing that anxiety has reduced and didn't realize that they were having they had more stressful times in their life that they couldn't control their anxiety. They were having anxiety attacks, or they just couldn't self-regulate very well. And so the vagus nerve, the phrenic nerve that helps with heart regulation and blood pressure, that can all be a factor in treating that area. So again, people can come and be treated for their shoulders and neck and not realize that it's coming from their chest. The same thing can be said, people can come in for, I have a classic hip and knee pain. And what happens is it can be coming from their back. It be coming from their viscera in their abdominal cavity, that the back, that is all related. We think that there's so much space in our body, but a lot of times there's a lot of things crammed in a smaller amount of space. And one of those things is a lot of nerves. And the nerves that exit your spinal cord and wrap around to innervate your legs, they can impact the organs that they're wrapping around before they then descend down through the extremities. So that is another thing that can happen. But I think what a lot of people are really surprised, and really the light bulb goes off and they really are excited to understand how they feel validated for things that they've been complaining about, and nobody's been able to put the puzzle pieces together. And I think that's what's the most fun for me, is to be able to put those puzzle pieces together and help them understand that their back pain, their foot pain, their neck pain could all be related to something that happened to them 15 years ago, and they never realized the connections that they all made. And so it's important, I think, that patients get that validation and finally feel like they're being heard, and this work can really do that for them.
Is it common for people to have been treated by multiple medical professionals with no relief and be told there's nothing diagnostically wrong, and then they come to you? Can you speak on that a little bit, repeating a little bit of what I said?
Yes. So often patients that I see have been through many, many different treatment approaches, different diagnostic tests, some invasive, and they're not getting any answers. And I always try to tell the patient that is a positive. If we can rule everything out, then that leads to, okay, what have we not left out? And a lot of times it's musculoskeletal dysfunctions. And so we don't think of people that have abdominal pain, GI symptoms, anxiety issues, vitality issues. So many different things can happen from restrictions in the body. And so a lot of people will finally be so validated that they have, that after all the tests and all the treatments from so many different people, they haven't gotten anywhere, because a lot of practitioners chase the pain. You need to find the dysfunction, and you need to find the part of the body that is causing that dysfunction. The body knows. We need to take our egos out of it, and we need to listen to the body. When I listen to the body, that body is telling me where I can help first, where I need to go first. And that is the most important thing in the work that I do, is trusting and respecting the body and what and where it wants me to go. And when I do that, it unwinds and it tells me its journey and its story, and the rest is success. It's beautiful, but it really comes down to paying attention to the patient, listening to the patient's history, putting the puzzle pieces together, definitely gathering information, but the bottom line is listening and respecting the body and going where it says to go.
Gave me a nice, beautiful smile.